Our organization, the Center for Children's Law and Policy, or CCLP, was created out of the East Coast office of the Youth Law Center, a public interest law office based in San Francisco that I helped create in 1978. I opened the East Coast office in 1994, and the staff and I formed CCLP as a separate nonprofit in 2006. Our mission is to reform juvenile justice and other systems that affect troubled children and youth, and to protect the rights of children in those systems, especially those who are incarcerated. For us, the first driver is the excessive use of incarceration. I've spent more than 30 years investigating local juvenile detention facilities, state juvenile institutions, jails where kids are held, and private facilities, many of which harm kids more than they help. Like others on our staff, I've seen a lot of dirty, dangerous conditions and practices. I've seen children handcuffed by their wrists and ankles to the four corners of their beds. I've seen children sprayed repeatedly with pepper spray, which is mace embedded with a burning chemical from cayenne pepper, for talking back to staff or disobeying a command. I've seen children locked alone in tiny rooms for 23 hours a day for weeks at a time. I've seen facilities so filthy and full of the smell of urine that it was hard to breathe. I've represented children in these facilities and children who were sexually assaulted and physically beaten by staff and by other incarcerated youth. The second driver for us is the pervasive impact of race in the system. As I've walked through facilities over the years, most of the faces I've seen are Black or Latino. Everywhere we see examples of what is euphemistically called disproportionate minority contact, or DMC, in the system. The intersection of race and incarceration has been an American dilemma for 400 years. In today's juvenile justice system, key stakeholders too often rely on racial and ethnic stereotypes to decide who gets locked up, or they use policies that impact youth of color differently. As a result, the school-to-prison pipeline drives one generation after the next into a downward spiral of frustration, failure, and isolation. Our goals are to end unnecessary incarceration of low-risk youth, to stop dangerous and abusive practices in juvenile facilities, and to eliminate policies that unfairly impact children of color. Our goals are to end unnecessary incarceration for low-risk youth, to stop dangerous and abusive practices in juvenile facilities, and to eliminate policies that unfairly impact children of color. First, to reduce unnecessary incarceration of low-risk youth, we work collaboratively with judges, probation officers, prosecutors, public defenders, and police, as well as parents and community representatives. We provide expertise to Pennsylvania's largest cities and 2 additional counties, and to Baltimore and other jurisdictions in Maryland as part of the Casey Foundation's Juvenile Detention Alternatives Initiative. We show them how to collect useful data on kids at key decision points in the system to make better decisions down the line. We help them develop objective screening instruments at detention so that only violent and chronic offenders are locked up. We advise them on developing community-based services, such as shelter care and after-school and evening programs, so that kids don't have to be incarcerated to get the supervision they need. We promote graduated responses to probation violations, so that youth aren't locked up for purely technical violations. Second, to stop dangerous and abusive practices, we conduct comprehensive trainings of local teams of judges, probation officers, prosecutors, public defenders, parents, physicians, nurses, educators, and mental health professionals to inspect their own juvenile detention facilities. We've developed a set of more than 300 best practices standards for the teams to use, covering every area of operations that affects the welfare of confined children. As JDAI expands its reach throughout the country, our goal is to make those juvenile detention facility standards the accepted professional standards in the field. We've conducted trainings for multiple teams in several states, including Alabama, Illinois, Indiana, Louisiana, Maryland, Massachusetts, Mississippi, New Jersey, and the District of Columbia. Our work has had major impact. Although deficiencies in Louisiana's juvenile facilities have been well documented, there have never been mandatory standards for detention facilities. To change that, we worked with the Louisiana Juvenile Detention Association, a statewide task force, and the Department of Children and Family Services to develop the first ever mandatory statewide standards. We hope to encourage other states to develop standards and oversight mechanisms. In Texas juvenile facilities, routine use of pepper spray on children sparked national outrage. At the request of state officials, we provided the scientific, legal, and policy research to help the state virtually eliminate the practice. Third, we focus on policies that unfairly impact youth of color. This is a difficult and sensitive issue to address, but we've developed a data-driven, strategic approach that avoids judgments and defensiveness for past practices. In the future, we want to take the next step beyond our current activities and funding sources. To stop dangerous practices in juvenile facilities, we want to work with other states to develop new or improved statewide juvenile detention standards and to develop new mechanisms for monitoring conditions in locked facilities. We also want to develop national best practices standards and methods for inspection for state commitment facilities. We'd like to have the capacity to conduct independent investigations of alleged abuses in juvenile facilities anywhere in the country. To address race in the juvenile justice system, we want to expand the number of jurisdictions we can help to reduce racial and ethnic disparities. We'd also like to have the time to do more writing about what we've learned in our work. Finally, to develop the next generation of leadership in juvenile justice, we've developed a proposal for an extensive training curriculum, mentoring program, and networking process for emerging leaders. We want to secure funding to move ahead on this project. We have 5 leverage points that make our organization successful. First, we focus initially on local officials and community members, judges, probation officers, public defenders, prosecutors, police, as well as parents and leaders of community organizations. The public officials move the system on a day-to-day basis. No reform can be effective unless they're engaged and supportive. Parents and community members keep the system honest. Their view of the system is often very different from those who get paid to work in the system every day. We encourage system players to understand how the system works from the point of view of young people, their parents, and their communities. Second, we work with state officials, state agencies, and state-level committees. We build on the lessons we've learned in our local efforts to help develop statewide policy and practice changes. For example, in Pennsylvania, we worked with the Juvenile Court Judges Commission to develop a new way to collect accurate data on Latino youth in the juvenile justice system. We also meet regularly with the state committee that addresses racial and ethnic disparities. In Connecticut, we work with the state's Court Social Services Division. In Maryland, we work with the Secretary of the Department of Juvenile Justice. In Louisiana, we worked with the Louisiana Juvenile Detention Association, a statewide task force, and the Department of Children and Family Services to develop new licensing standards for juvenile detention facilities. Third, we advise federal officials in the executive branch, as well as members of Congress. We work with top administrators at the Office of Juvenile Justice and Delinquency Prevention. We developed a project for SAMHSA, the Substance Abuse and Mental Health Services Administration, on race, substance abuse treatment, and mental health services. The State Department asks us to brief judges, attorneys, advocates, and other officials from foreign countries on the juvenile justice system in the United States. The National Prison Rape Elimination Commission hired us as consultants. On the legislative side, in Congress, we've provided research and policy advice to the chairs, members, and staffs of the Senate Judiciary Committee and several House committees. Fourth, we work closely with the leading foundations in the country supporting juvenile justice reform. We've been involved with the Casey Foundation's Juvenile Detention Alternatives Initiative since it began in 1992. We helped plan the MacArthur Foundation's Models for Change initiative. We've also been able to help these foundations shape their goals and their grant-making. Fifth, we work with other leading nonprofits in the juvenile justice field. These collaborations allow us to draw on the skills and experience of other effective advocates and multiply our impact on behalf of troubled and at-risk children. The first thing that makes our organization effective is our vision of a better juvenile justice system. We believe in decarceration, closing down large, ineffective juvenile facilities in favor of creating community-based programs and services for most kids and small, secure programs with well-trained staffs for the small number who need to be confined. We believe in positive youth development, building on the strengths that every child has rather than focusing on the weaknesses. We believe in holding children accountable for their individual behavior, not by whether they are members of a particular racial or ethnic group. A second thing that makes us effective is the combination of skill and experience we bring to our work. We've assembled a strong, racially diverse staff with plenty of relevant experience. For example, I've litigated over harmful conditions in facilities for more than 30 years. I've been involved with systems reforms initiatives for almost 20 years. From 1998 to 2005, I led an initiative called Building Blocks for Youth, the first comprehensive, multi-strategy effort to reduce racial and ethnic disparities affecting youth of color in the justice system. Dana Schoenberg, our deputy director, came to us from the U.S. Department of Justice, Civil Rights Division, Special Litigation Section. There, she investigated, litigated, and worked with jurisdictions to solve allegations of abuse and civil rights violations in jails, prisons, juvenile facilities, and police departments. Before that, she taught in 2 law school legal services clinics. Tiana Davis, our DMC policy director, was DMC coordinator and oversaw effective detention reform efforts in Baltimore County, Maryland, then worked as director of community programming for the Mayor's Office on Criminal Justice in Baltimore City. Lisa Macaluso, our senior juvenile justice policy advisor, was the deputy director for crime prevention for the New Jersey Attorney General and also worked for the New Jersey Juvenile Justice Commission, where she led state-level detention reform that encompassed major urban areas. Staff attorney Jason Zaney worked for the D.C. Public Defender Service inside one of the D.C. juvenile facilities, investigating youth grievances and representing youth in disciplinary matters. The third thing that makes us effective is our approach to the work. We're advocates, experts at a national organization, but our approach is collaborative. We're former litigators who work with public officials to avoid litigation. We're trusted by public officials to give them solid advice based on the most recent developments in the field. We're former public officials who know the limitations and frustrations of government bureaucracies. We know how to push when necessary, but we also know when pushing hard is counterproductive. We're idealists in our vision, but realists in our practice. We're also effective because we know how to use multiple strategies to accomplish our goals. The juvenile justice system is more than 100 years old, and many of its problems have built up over long periods of time. Solving those problems requires a variety of strategies, often several at once. We know how to use training, technical assistance, public education, research and writing, media advocacy, collaboration with public officials, legislative advocacy, and, if necessary, litigation. We speak with experience from seeing and supporting reform on the ground in many jurisdictions across the country. We're effective on racial issues because we've deconstructed the problem to make it possible to address. We're not going to solve the enormous problems of poverty and racism in this country, but we can take a close look at how key people make specific decisions about particular children in the system, and we can suggest different, more effective, and unbiased ways to handle those decisions. We measure success in several ways. We focus on outcomes, not on process. Therefore, our first measure of success is the number of children whose lives are better because of our work. We count numbers and percentages. For example, in Berks County, Pennsylvania, which includes the city of Reading, we aim to reduce the number of children of color locked up in the county juvenile detention center and sent away to placements far from home. We collected data on the entire juvenile justice system in the county. When the data revealed that most young people locked up were not charged with serious offenses, we helped the county develop the first detention screening instrument in the state to make sure that only dangerous youth were locked up. Then we helped the county develop the state's first evening reporting center. Under court order, children go there after school, get help with their homework, have supervised activities and dinner, and then are taken home mid-evening. As a result of the detention screening instrument and the evening reporting center, Berks County reduced its detention population, which was largely Latino youth, from a high of 54 children per day to a low of 8. And overall, the average detention population is down 65%. County officials closed a 24-bed unit, took the locks off the doors, and used the space for a reentry program. Further, using a data-driven approach and evidence-based programs, Berks County reduced its post-disposition, out-of-home placements by 50%. Berks County is not an isolated example. Sedgwick County, Kansas, which includes Wichita, focused on arrests for shoplifting and disorderly conduct in schools, which were major reasons that kids went into the juvenile justice system. Using a data-driven approach similar to Berks County, Sedgwick reduced shoplifting arrests by 27%, including 26% reduction in arrests by Black youth, and reduced disorderly conduct arrests by 30%. We also provided help to Rock County, Wisconsin, which includes the city of Beloit. Using similar strategies, Rock County reduced admissions to detention by 45%, including a 35% reduction in admissions of youth of color for probation violations. A second measure of success is the money saved by public officials by reducing unnecessary incarceration. In Berks County, the reductions in out-of-home placements saved the county $2 million in 1 year. In one county in Wisconsin, our approach enabled the county to save over $800,000 a year. Some states make strategic investments in order to save big money down the road. Pennsylvania officials were so impressed by the success in Berks County that they funded 4 more evening reporting centers in the state and required each one to adopt a detention screening instrument. Third, when we work to change dangerous conditions and practices in juvenile facilities, we measure success both by the number of young people potentially affected and by the nature of the changes. Our work helping the state of Texas virtually eliminate the use of pepper spray affected many of the 42,000 youth held in detention each year and the 1,700 youth held in state-run commitment facilities. Our efforts to develop new juvenile detention facility licensing standards for Louisiana affect every one of the more than 14,000 youth held in detention annually in the state. Equally important is the nature of the changes. The Louisiana detention standards prohibited, for the first time, the use of pepper spray and restraint chairs, which were used in some of the juvenile facilities. The change in Texas policy stopped a dangerous practice that had been used routinely for many years. The work we're doing on new policies regarding incarcerated lesbian, gay, bisexual, and transgendered youth brings a whole new way of thinking to work with youth who have historically been marginalized, abused, or ignored. Our work on the Prison Rape Elimination Act regulations provides a foundation for new prevention, investigation, training, and monitoring policies for juvenile facilities throughout the country. An aspect of our organization that's sometimes misinterpreted is the role of the lawyers on our staff. Some of us have been involved in litigation in the past over dangerous conditions in juvenile and adult facilities, and some of the cases got considerable publicity. As a result, public officials are occasionally concerned that we may want to inspect their juvenile facility or collect data on agency operations solely as a way of setting up a new lawsuit. In fact, our approach at CCLP, since we began in 2006, has been to work cooperatively with public officials to help them solve their problems. The Casey Foundation's Juvenile Detention Alternatives Initiative and the MacArthur Foundation's Models for Change are insider initiatives. They're premised on outside consultants, such as CCLP, working collaboratively with local and state officials. The most difficult situations for us occur when we're asked to inspect a juvenile facility and learn about a dangerous practice that immediately threatens the health or safety of incarcerated children. If we're working as consultants, we can't file a lawsuit or call a reporter. Instead, we quickly learn as much as we can about the practice. We look at how often it's used and how many children it affects. We gather legal and policy research on the practice. Then we bring that information to key decision makers in the system, going as high as necessary in the chain of command. We work with the officials to design a long-term solution to the problem. For example, the immediate danger may be the use of pepper spray when kids misbehave, but the underlying problem may be inadequate training of staff to address confrontation situations by de-escalating youth behaviors, or lack of mental health professionals to work with very troubled youth, or a poorly designed behavior management system that doesn't provide sufficient rewards and sanctions to persuade youth to control their behavior. If we aren't working as consultants and officials refuse to change a dangerous practice, we want to keep the options of suing them to make them stop or going to the press. That gives us a full range of options as advocates for children. We're proudest of 3 accomplishments over the past few years. First, we planned and managed the Disproportionate Minority Contact Action Network for the MacArthur Foundation's Models for Change initiative. The DMC Action Network brought together 17 jurisdictions in 8 states to adopt strategic innovations, share experiences, learn from creative people outside the network, and help each other reduce racial and ethnic disparities affecting young people of color. The ideas we've shared with them and the skills and strategies we help them develop have had measurable, meaningful impact on the lives of children of color in their communities. We held 3 national conferences and a cross-action network conference with MacArthur's other action networks on mental health and juvenile indigent defense. We've published 26 issues of the DMC e-News, an electronic newsletter that goes out to hundreds of public officials and advocates all over the country, giving them concrete, understandable ideas about how to reduce racial and ethnic disparities. We've helped our local jurisdictions get recognition for their efforts in local media, and we've published articles in the Georgetown University and Louisiana State University law reviews. Second, as part of the Casey Foundation's Juvenile Detention Alternatives Initiative, we developed a comprehensive set of more than 300 juvenile detention facility standards, covering all major aspects of facility policy and practice that affect incarcerated children. We've trained local teams on the standards in 9 states and the District of Columbia. We've also developed a detailed protocol for the teams on how to prepare for and carry out the assessment from the day they decide to do the assessment to the day they complete their report. The process has led to major reforms in many jurisdictions, from elimination of the use of pepper spray on kids to increased mental health resources in facilities. The standards have influenced local and state officials, U.S. Department of Justice staff, the Prison Rape Elimination Commission, and attorneys and other advocates around the country. Third, based on the JDAI juvenile facility standards, we worked closely with the Louisiana Juvenile Detention Association to develop the first ever licensing standards for juvenile detention facilities in the state. Reports of abuse in Louisiana juvenile facilities go back more than 35 years. So-called voluntary standards were never effective. Some facilities use pepper spray and restraint chairs. With the new licensing standards, modeled closely on the JDAI standards, Louisiana moves to the front lines of leadership in protecting detained children from abuse and mistreatment. The biggest challenge we face is the uncertainty of funding. This is an issue for us in several ways. In years past, the federal government was one of our major funders. In the 1990s, the Office of Juvenile Justice and Delinquency Prevention was a key funder of Building Blocks for Youth. In recent years, OJJDP has absorbed major budget cuts, so there's much less money available for independent reform projects. In addition, with partisan battles over the federal budget, OJJDP can only commit to 1 year of funding at a time. When an organization receives a federal grant, there's often a long delay between the start date for the grant and the time the agency actually makes the money available so that the work can start. For a small nonprofit like ours, this makes it very difficult to hire new staff, set annual operating budgets, or maintain strong cash flow. One thing that's helped us is that major foundations have used their own funds to leverage matching federal grants. The Casey and MacArthur Foundations each have entered into joint agreements with OJJDP to provide public and private funding to us. This allows us to do detention reform and work to reduce racial and ethnic disparities. We hope other foundations will adopt this model or provide funds separately from the federal government to help us carry out our work. The difficulties with federal funding force us to rely on foundations for much of our budget, but there are few foundations that have funded juvenile justice reform. Among the few foundations that do fund juvenile justice reform, most have set guidelines for what activities they'll support or the states in which they'll work. As a result, we have to continually go back to the small number of funders who have been strong supporters of reform. And we constantly worry that those foundations will change their priorities or that another downturn in the stock market will sharply reduce the funds they have available for grants. These are common complaints among nonprofits. Like others, we dream of a time when private fundraising, led by board members, will provide us with a stable financial base. But that has proved very difficult to accomplish. One complicating factor for us is that young people who commit crimes are not a very sympathetic population, so soliciting donations for better treatment of them can be a tough sell. In addition, the vision we pursue and the reforms we work to achieve require support over extended periods of time. We're not going to bring fundamental change in America's obsession with incarceration or overcome 4 centuries of racial bias with a 1-year grant. Thus, we need multi-year support by funders who understand the magnitude of the changes we seek and have the commitment to stick with reform efforts for the long haul. We've developed several projects that we're hoping to get funded. We'd like to develop standards for state juvenile commitment facilities similar to the JDAI standards we developed for local juvenile detention centers. The juvenile detention facility standards have been very influential. JDAI sites around the country have used them to change their policies and practices. The Louisiana Juvenile Detention Association used them for many of the new licensing standards. The Federal Prison Rape Elimination Commission considered them in developing proposed regulations for juvenile facilities nationwide. Similar standards would be instrumental in stopping dangerous and abusive practices in state juvenile facilities. In addition, the Federal Bureau of Justice Statistics estimates that more than 1 in 10 children held in secure juvenile facilities fall victim to sexual abuse by staff or other youth. The Prison Rape Elimination Act, or PREA, holds the promise to end this abuse, but only if state and local officials receive the help they need to implement the law's requirements. Officials in the New York State and New York City juvenile justice agencies recognize the importance of PREA's requirements and want us to help them create safer facilities for the children in their care. In partnership with both departments, we want to develop policies, conduct trainings, and provide assistance with implementation. This project would make the state a leader in addressing sexual misconduct. It would also fill a critical void in the field by producing a successful and replicable model for PREA implementation that could make facilities safer throughout the country. We also want to develop a center for information and assistance on independent monitoring of conditions in juvenile facilities. Young people in juvenile facilities need safe, reliable, and independent places to report physical and sexual abuse, staff misconduct, and lack of care. And system leaders need outside expert eyes and ears to help identify and remedy problems. There are several models of independent monitoring systems, including ombudsman offices, executive branch monitoring agencies, state offices of the child advocate, and special public defender offices located inside juvenile facilities or in state-level agencies. We want to develop a central location for information and advice on effective mechanisms and state and local experiences. Finally, we'd like to get funding for a project we've developed called the Future Project to train the next generation of leaders in juvenile justice system reform. This is a major issue for our field as the juvenile justice leaders of the past 30 years begin to retire. The Future Project's mission is to ensure that well-trained juvenile justice practitioners, mental health and education experts, attorneys, government officials, and nonprofit leaders are prepared to spearhead future juvenile justice system reform efforts throughout the country. The program includes interdisciplinary training, skill-building activities, mentoring by experienced advocates, local problem solving, networking with peers, leadership development, and career guidance. The project has a particular focus on identifying and supporting people of color as new leaders. There are several areas where we could fill gaps if we had more resources. Two of the most prominent are on the issues of overuse of incarceration in the juvenile justice system and abusive use of restraints and isolation in juvenile facilities. There are two types of gaps closely related for each issue. First, there's a gap in support for key advocacy activities. Advocates in our field can sometimes find support for training, technical assistance, research and writing, collaboration with public officials, and development of new policies and practices. Most major juvenile justice initiatives, whether funded by foundations or government agencies, utilize one or more of these strategies. But there is little support, if any, for other advocacy strategies that are more direct or confrontational, such as lobbying, litigation, or media campaigns. Few funders, private or public, will support such activities. Yet these strategies may make a critical difference by exposing abuses, putting pressure on public officials to make changes, or encouraging legislators to pass laws targeting broad-scale solutions. Second, there's a gap in coordinating national leadership among advocates to bring about the closure of large, dangerous, often abusive, locked facilities. More than a dozen advocacy organizations have met over the past 2 years to talk about the importance of closing large warehouse-like state facilities for young people. But no one organization has been able to take the lead to galvanize the energy and plan a comprehensive, multi-strategy, multi-year campaign to accomplish this goal. This is different from, but complementary to, the Casey Foundation's commitment to reducing deep-end incarceration. The Casey Foundation works with system stakeholders to reduce unnecessary use of out-of-home placement. I'm talking about a campaign by independent, outside advocates to expose the dangers and deficiencies in state training schools. If those gaps I'm talking about were filled, we could see a coordinated campaign to close large state facilities. It would work closely with national, state, and local advocates, with foundations supporting similar goals, with state legislators, and with federal agencies and members of Congress. It would plan the strategic use of the full range of advocacy activities and develop specific goals and a multi-year agenda. Similarly, we'd love to lead a well-planned campaign to expose and eliminate the harsh use of restraints and extended isolation in juvenile facilities. On either issue, we at CCLP would be interested in taking a leadership role if sufficient resources and support were available. On a different issue, there's a gap in our field in thinking about the impact of technology on the juvenile justice system in the next decade. There's a principle of technology that says that the capacity of computers to process information doubles every 2 years. That principle has been accurate since 1965. 10 years from now, computer capacity will have doubled 5 times over. Today, few jurisdictions have integrated information across agencies, and many jurisdictions still do hand calculations for their reports. 10 years from now, information about troubled children and their families should be available instantaneously to every employee with a need to know in every agency that has contact with them. Video calls and conferencing will be cheap and universally accessible. These developments will have vast implications for supervision and treatment. They also may present unseen dangers if there's an erosion of confidentiality. Advocates for children aren't talking about these issues, but we'd be interested in starting those discussions.